So the last part of a note is the intervention plan, and this is the same regardless of what type of note you are writing. So we'll combine these together. Again, it's important to understand that there are different components associated with that idea of the prognosis and the different goals, where those go, whether they are part of the assessment or part of the plan. So we'll kind of be bouncing back and forth associated with that. But we're specifically going to look at what all needs to be included in the intervention plan. And so this is chapter 20. So this bouncing back and forth comes from the idea that once the goals are set, the intervention plan is going to be the summary of the types of treatments that are going to occur in order to improve that patient's functional status and reach those short-term goals, and then ideally, right, the expected outcomes with that. So when you're creating this plan, and again, it's more of a summary in nature, we'll have a list of all of the things that can be included on the next slide. But it's important that when we look at this and we're doing this, we're taking in this holistic approach to patient care, right? We need to identify and understand the anticipated goals that we created. Ideally, this is done with the patient at some level, right? But then also this idea that we may not be able to reach all of the goals in the time that we have. And so some other limitations may come into play, and that would be need to be included in the intervention plan. Every patient has some sort of limitation that might affect the plan. So when we get into the writing the plan, right, these are all of the different things that need to be included within that plan, right? The first is obviously the type of therapy setting with that. That'll be somewhat different based on where you are working, right? Whether it's at home, in the athletic training room, at practice, different components associated there, right? Even in your intervention plan, it might just be, pure home exercise. So identifying what that is. We also need to identify the frequency and the length of time that we expect the patient to be seen for the full course of services. Now, when we get in there, right, you can always get into the, aspect of, until resolved or whatever, but you want some sort of anticipated length of time. This is more important, right, for getting approval for like physical therapy visits or payment with there. Where the treatment is going to occur, right, also go in there if you're going to be using multiple settings with that. And then obviously at least some idea of the interventions that they will receive and the plan progression for these interventions, right? Again, the idea that we will have daily notes that will be able to explain what exactly we're doing in more detail, but for providers or for insurance companies that are reading our evaluation notes, we want to show that we've created a plan for them and let those individuals know basically what we're going to be doing for them, right? Then comes some more specific aspects when, where we would expect them to be discharged to, obviously much more important if you have people going from the hospital to an acute inpatient clinic, to a nursing home, back home, different aspects. For us, not as big of a deal with that. Plans for further examination or re-examination, usually very standard, at least, monthly or every 6 weeks associated with that. Any other referrals that we may want, like if our plan is to refer them out for like orthotics or something like that, maybe for a brace, education, and then equipment that you maybe have given them and been educated for, as well as equipment after discharge. So when we get into this for our worksheet, we're going to be, again, going through and identifying which of these we would expect to be included in the intervention plan, and then mark them as expected outcomes or anticipated goals within there. For the second part, then, we're working on this information from that we've had previously, and we're going to now take this that we had and try to create a new plan using the abbreviations where appropriate, and as concise and logical as possible. So you have the information now listed there, and you're going to write out your own intervention plan. And so that is the end of that. If you have any questions, please let me know.